a health problem, first the doctor will ask you a number of questions. Rather than trying to keep it in your head, you might write down the information first to be able to provide that information to the healthcare professional so that information can proceed more quickly. You might be asked a number of questions. What are you eating? Do you have a headache? If something hurts. Remember, it's important to tell them. That way they can help understand what the problem is and help make you healthy. Okay, enough about questions. The doctor or nurse will observe you and check different things to see about your health. For instance, they will look into your ears, your mouth, your nose, check your eyes, and also use a stethoscope. They might palpate your back to listen to your lungs and check your chest for different signs. Make sure your heart sounds right and your liver. They might ask you to lay on the table and palpate your stomach area to see if your liver's all right and check your other organs. I'm sure you're familiar with the blood pressure cuff. Sometimes when you go to the hospital, the nurse will always put on the blood pressure cuff, pump it up, and see if your blood pressure is high or low, or just right. If it's high, it can really be a problem. It could mean that you're at risk for a heart attack, at risk for a stroke. It could mean you have a kidney problem. So it's really important that they check your blood pressure. If people find out that it's high, they may give you medicine to help lower your blood pressure. Rather than ignoring it, it's better that you get a check so you know that you're at risk for a heart attack. Laboratory tests. After the physical inspection, you may be asked to provide information for a laboratory test. They might take your blood, have you give a urine sample or a bowel sample. It's really important so that they can check for other problems. You might have a kidney problem, have a problem with your bowels. You could be at risk for cancer. So it's important that those studies are done to see if there might be a problem. A blood test could help tell if your body has an infection, could tell sometimes things about your food, your eating habits. A number of different things could be analyzed from your blood test. So it can help identify very specific problems. Sometimes your blood might be analyzed with a slide. You might be asked to provide a urine sample. It's also very important to check your health. The doctor and nurse will analyze it and make sure you're healthy. They might tell you specific instructions. Be sure if you don't understand the instructions to ask so that you understand clearly. Just go ahead and ask again so that you can be very clear on the instructions. If sometimes people might say don't have food before the test all night, or if you can have drinking in the morning of the test, be sure to understand those requirements so the test doesn't have to be repeated. All of those helps help the medical professionals understand your health. It's important that they check your physical health and the lab tests. And also, they will ask you a number of questions. It's important that you tell them clearly how you feel, and then it be the truth. Don't tell lies or be fuzzy about it. If you may feel that it's private information. Your different habits, drinking habits, drug habits, smoking habits, all kinds of different habits that you might have. You might feel tempted to tell a lie, and the doctor will believe it, but they might give you different solutions later on that would conflict with those habits. Remember, if you tell them information, it's really between you and the healthcare professionals. They're the only ones that'll know. It's private information. Meeting with the doctor. The doctor will do the physical exam and check your health. If they find a specific problem, they may put that together with the other information, the exam, the lab test results, and understand more along with the questions that they ask you, maybe about the diet. The physician may send you to another specialist who has more specific knowledge in a specific area that may be a problem for you. Be sure to go ahead and ask any questions that you have about your body and your feeling, about medicine. Be sure to understand how often to take it, how much, how long, how the medicine will help you. And remember that sometimes the medicine might be taken with food or without food, so be sure to understand that. Remember also that different people have different impacts from different medications. Some people might have reactions to medicine. Some people, it might be not as efficacious as with another person. So be sure to tell the doctor how you're feeling, and the doctor could change the medication if it's not working well for you. It's important you have to persevere and follow the directions from the physician. Continue to go to all of your appointments so that your health will improve. Don't feel that, oh, I'm tired today and, it didn't help overnight. Maybe you've been feeling sick for a long time. And it, sometimes that you can improve quickly, but other times it takes time to improve. I'm warning you, it does take patience working with the doctor for improvement. So I really hope that you're ready to work together as a team with your doctor and your nurse and the other staff members. It's so important that you work together with that team. I hope that you continue to care for yourself and take care of your health. Remember, you only have one life, and you really want a healthy life and a happy life. Good luck. Bye-bye.